Hello, and welcome to this video today. We are going to talk about an important topic for families and seniors. Signs and symptoms of heart attack in seniors. Heart attacks are dangerous, but receiving early warning signs and calling for medical help right away can save lives. Seniors may experience unusual or subtle heart attack symptoms. Because of this, it is very important to know what to watch for. Today, we will talk about the warning signs of a heart attack in older adults, risk factors, and what to do if you or your loved one is having the symptoms. Section 1. What is a heart attack? A heart attack, also called a myocardial infarction, happens when the flow of blood to an area of the heart muscle is blocked. This blockage usually occurs when a blood clot forms in one of the coronary arteries that supply oxygenated blood to the heart. When the heart muscle is deprived of sufficient blood, it becomes damaged or even dies. Heart attacks occur most commonly as a result of coronary artery disease. In this condition, plaque, a mixture of fat, cholesterol, and other substances, builds up and also constricts the arteries. This reduces blood flow. With time, the plaque can burst. It could create a clot that results in a heart attack. Section 2. Risk factors of heart attack in elderly. There are a lot of things that can increase the risk of a heart attack in the elderly. Some can be managed, while others cannot. Knowing these risks can help prevent them. 1. Age. The risk of heart attack rises with age, particularly after the age of 65. As age advances, the heart and the blood vessels become less efficient, naturally, and cardiovascular complications are more likely to develop. 2. High blood pressure. Hypertension, or high blood pressure, is a significant contributor to heart disease. It causes increased pressure on the heart, damaging the arteries and increasing the risk of heart attacks. 3. High cholesterol. Cholesterol, if high, can cause the narrowing of arteries by the accumulation of plaque. This will block blood vessels and increase the chances of a heart attack. 4. Diabetes. Diabetes raises the risk of heart disease and heart attack. High blood sugar can harm the heart and blood vessels and cause other problems. 5. Obesity. Being overweight and obesity put extra strain on the heart and can lead to high blood pressure, high cholesterol, and other conditions that increase the risk of heart disease. 6. Smoking. Smoking harms blood vessels, elevates blood pressure, and boosts the risk of heart disease and heart attacks. 7. Family background. If there is a history of heart disease in your family, you may be more prone to having the same problems. Your genes can have a big influence on your heart's health. Section 3. Signs and symptoms of heart attack. Among older adult, symptoms of a heart attack are different for each person. One of the symptoms is chest pain, but elderly individuals might experience subtle symptoms or signs that are not easily recognized. Understanding what to look for, you can get medical help right away if you need it. 1. Chest pain or discomfort. Most common symptom of a heart attack is chest pain or discomfort. Older people may describe this as a tightness, heaviness, squeezing, or ache across the chest. The pain can be intermittent or last for several minutes. However, some older people do not experience classic chest pain, and pain may be less severe or localized in the upper back or abdomen. Stock footage suggestion. An elderly individual clutching their chest or showing signs of pain while standing or seated. 2. Shortness of breath. Shortness of breath, even while at rest, can indicate a heart attack. Elderly individuals may experience fatigue, dizziness, or difficulty breathing. This symptom may occur along with chest pain or on its own. Stock footage idea. An older person looking like they are having trouble breathing while walking or sitting. 3. Pain or discomfort in other parts of the body. Elderly people can have pain or discomfort in areas other than the chest, like the arms, most often the left arm, shoulders, neck, back, jaw, or abdomen. It is generally a silent symptom, but cannot be neglected. Stock footage idea. An older adult holding their arm, neck, or back in pain may be rubbing their shoulder or neck. 4. Nausea, vomiting, or indigestion. Older adults might become nauseous, vomit, or have a feeling of stomach discomfort during a heart attack. They might confuse these symptoms with a stomach problem, but they can also indicate a heart attack, especially if they happen together with other symptoms like shortness of breath or chest discomfort. A senior is sitting at a table. They look uncomfortable and are holding their stomach, which may mean they feel sick. 5. Mild headaches or dizziness. Light aches, faintness, or dizziness is a typical symptom of a heart attack. This may occur due to poor circulation of blood by the heart, thus causing low blood pressure. Confusion or inability to think properly can also be felt by older individuals. Stock footage concept: an older adult grasping a surface nearby or sitting down due to dizziness or slight headaches. 6. Cold sweats. Feeling very sweaty and cold is a common sign of a heart attack. This can also happen with pale or sticky skin, and it might happen even when you are not doing anything active. Stock footage idea: an elderly person mopping their forehead with a tissue or looking uncomfortable because of sweating. 7. Fatigue or extreme tiredness that is not alleviated by rest is a sign of a heart attack, especially among older people. They become very weak or tired without much exertion. Stock footage concept: older person looking tired or lying on a couch or chair, exhausted. 8. Abnormal heartbeat or palpitations. A feeling of a fast or irregular heartbeat. Palpitations is a sign of a heart attack as the heart tries to keep up a normal rate in the event of a heart condition. Stock footage idea: an elderly person checking their wrist or chest, possibly taking a measurement of their pulse or heart rate. Section 4. What to do if you suspect a heart attack. If you or someone with you exhibits signs of a heart attack, it is very crucial to respond quickly. Below are the procedures to undertake in case you suspect there is a heart attack. 1. Call for help. The first and most crucial action is to dial emergency services immediately. Heart attacks require immediate treatment, and waiting for medical attention can increase the likelihood of issues. Concept for a video: an elderly person calling 911 or emergency services over the telephone. 2. Chew aspirin if it's okay with your doctor. If the person is awake and not allergic to aspirin, they should chew one regular strength aspirin 3 to 5 mg to make the severity of the heart attack less by thinning the blood and increasing the flow of blood. But do consult a doctor first. Stock footage concept: a senior person taking an aspirin tablet with water. 3. Remain calm and relax. You wait for help to come. Be calm and relax. Do not do heavy work, and don't try to walk or drive yourself to the hospital. Sitting comfortably or staying in bed can take pressure off your heart. Stock footage concept: elderly person in comfort, seated or in a lying position, waiting to see a doctor. 4. Provide CPR if necessary. If the person loses consciousness and is no longer responsive, begin CPR. Chest compressions can keep the blood circulating until help arrives. If you are not SPAR trained, the dispatcher can instruct you. Stock footage concept: a family member or caregiver performing CPR on an elderly person, with assistance from the emergency services. Section 5. Avoiding heart attack among older adults. Heart attacks can't always be avoided, but there are some things older adults can do to minimize their risk. 1. Manage chronic conditions. Certain diseases like high blood pressure, diabetes, and high cholesterol are likely to cause heart attacks. Regular visits to a doctor to check and control these diseases are very essential for a healthy heart. Stock footage idea: an elderly person going to see a doctor for a checkup or checking their blood pressure. 2. Eat a heart-healthy diet. A diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats can help lower the risk of heart disease. Try to limit sodium, saturated fats, and processed foods. Stock photo suggestion: a senior preparing a heart-healthy dish with vegetables, lean protein, and whole grains. 3. Regular exercise makes the heart stronger and also enhances the flow of blood. Try to get at least 150 minutes of moderate exercise a week, like walking, cycling, or swimming. Stock footage idea: a person who is older walking in the park or doing a group exercise class. 4. Give up alcohol and smoking. Excessive alcohol consumption and smoking are significant contributors to heart disease. Stopping smoking in moderation and drinking can greatly cut down the risk of having a heart attack. Stock footage suggestion: a senior throwing away a pack of cigarettes or having a moderate drink. Conclusion: in conclusion, it is very important to identify the signs and symptoms of a heart attack in older persons for early help. Older persons can have unusual symptoms, so a person should be aware and get medical help right away if there are any symptoms. By controlling risk factors, following a heart-healthy lifestyle, and being aware of warning signs, older persons can take steps toward decreasing the risk of heart attacks and improving overall cardiac health. Thank you for viewing our video today. If you found the information helpful, please like, subscribe, and share. Let's continue the conversation on heart health and live longer, healthier lives. Take care and see you in the next videos.